My name is Dr. Rhian Davies. I work at WellSpan in York, Pennsylvania. I'm a director of complex coronary, primarily a CTO operator. I've been able to use C2 Plus now for a couple of weeks, maybe even a month or so, and the advantages that I find is that the opportunity to have more pulses. The additional pulses with the C2 Plus come in handy whenever you're treating an eccentric calcium or nodular calcium. I find particularly in the CTO space, there's a lot of nodules, even in those subtotal vessels, and it's nice to have the opportunity to lay on those nodules a little bit longer than maybe we would have been able to with the prior version. The advantage of the additional pulses with C2 Plus in treating kind of diffuse calcium that has eccentric and maybe nodular calcium mixed in there gives you the opportunity to treat it entirety with usually one balloon, because what you can do is do a couple pulses where it's kind of that diffuse or eccentric calcium, but when you come to the nodular areas, you can actually lay on it with a few extra cycles, anywhere from maybe 20 or 30 pulses, to just verify that you're getting improvement in that balloon expansion and cracking into the deeper calcium. Having that opportunity to have the 40 pulses more really kind of just makes you easier with treating that entire vessel rather than worrying that you might run out of pulses in the more proximal vessel or somewhere else that you may need to treat more aggressively. With C2 Plus, I think it's advantageous with the extra pulses. So sometimes I'll treat the LAD and then maybe I'll have some disease at the ostium of a diagonal, and having the ability to maybe even remove the Shockwave balloon and re-advance it into one of these side branches gives you an opportunity to maybe treat more than what you would have previously with not as many pulses. I like the C2 Plus device, particularly in the patients that have that eccentric or nodular calcium, primarily even in the older female population. You know, they're just more susceptible to adverse outcomes, sometimes with some of the other calcium modification tools that we have. So the ability to not have to go super high on your inflations and be able to treat the calcium thoroughly really gives you that sense of satisfaction, but also encouragement that you've actually treated the vessel and you're not leaving behind areas that have resistant calcium.